kids can be a handful. And that's exactly why active supervision is so important. Active supervision is the most direct and most effective safety strategy possible to prevent injuries in children, which means that active supervision has to be a top priority for delivering high-quality childcare. Young children are constantly trying new things as they grow that help develop both their motor skills and their social skills. These adventurous spirits and exploratory behaviors that can sometimes be a little frustrating are vitally necessary to their healthy growth and development. As a child care teacher, it is your responsibility to encourage children to explore and try new things, and also to actively supervise their activities to help prevent any serious injuries from occurring. Minor scrapes and bruises are going to happen on a regular basis in groups of young children in any normal environment, but serious injury is usually highly preventable with good supervision practices. So what does active supervision in an indoor environment look like? It looks like teachers actively engaged with the children, sometimes joining in their play, and always nearby and available. It looks like most interactions happening between adults and children, rather than between adults. To help you develop your own plan for ongoing active supervision in your childcare setting, consider the following strategies. First, set your space up purposefully. Take the time to plan and set up the environment so there are no blind spots and teachers can see all children all the time. Use low shelving units that teachers can easily see over. And make sure the diaper changing area faces into the room so that the teacher can see the children and not have their back to them. Position yourself among the children and move throughout the space regularly to check areas that are difficult to see. Teachers need to be able to both see and hear all of the children and to be able to stay close to children who may need additional support. Face into the room when sitting at a table with children, for example. Make sure that there are always clear paths to where children are and safety concerns are addressed so you can react quickly when necessary. Keep an eye on the children at all times by scanning the room and regularly counting kids to make sure no one is missing, and checking the sign-in sheet to ensure the count is accurate. A face-to-name check is always a good idea as children move around, possibly making the head count inaccurate. If you don't see one of the children, first check all the areas in the vicinity where kids might hide. If a child doesn't return quickly from a bathroom trip, make sure you check on them. Consider leaving a bell or some other type of noisemaker on the door to alert you when someone is entering or leaving. For a 2-year-old, it seems there's no greater thrill than to escape. It's hard enough to keep a count of a fixed number on children all day, but when that number fluctuates, it can be twice as difficult. Make sure you have a process in place to allow for any children who might arrive late or leave early so that your group count is always updated accordingly. Your ears will tell you a world of information if you pay attention to them. We all subconsciously recognize when the normal soundscape around us changes, but you need to be more attuned to your surrounding sounds when caring for children. Specific sounds, or the absence of sounds, may signify a reason for concern. Use your knowledge of each child's individual development and abilities to anticipate what a child may do. You see them on a daily basis. You know their quirks. Does one of your kids climb? Or several? Does one like to burrow under blankets or into small private places? Are there known circumstances where issues are more likely to occur? The best way to prevent issues is to guide them and redirect them when necessary before the issue arises. This only happens with regular engagement, and the best engagement is joining them in play. The more you engage with them and provide active supervision, the more you can prevent issues from arising and improve children's safety. Children are truly our most precious resource, and it's only right that we take the utmost precautions in ensuring their safety while they are in our care.